Thank you so much for joining JOGO Health's today's webinar. We are going to discuss how JOGO Health can help save companies cost and improve productivity in health conditions, around 21 health conditions. So let me share my screen. So JOGO Health, we are a Mayo Clinic Ventures company. We are funded by Mayo Clinic. Also, Mayo Clinic is a co-development partner with us. We have been cleared by the FDA. All our pain research happens at Harvard Medical School and Brigham and Women's Hospital. We have come out of two incubators. One is Johnson & Johnson's Innovation Labs at UPenn, and also UMass Lowell M2D2 biotech innovations. Basically, JOGO helps reduce ER costs, medication costs, surgical and presentism costs for migraine, chronic pain, and 21 other medical conditions. And we are available in the United States, Canada, India, and also in the UAE, very specifically Dubai and Abu Dhabi. So let's talk about our first indication, which is migraines. So climate change is making migraines and other neuro conditions worse. That's a recent study that came out. Not that migraine wasn't a big problem before, but it is a bigger problem now. And recently, Harvard Business Review wrote an article saying migraines are a serious problem that employers need to help. And in the UK, a lawmaker quit her job last year and wrote this editorial saying people living with migraines need better support from employers. All in all, this has become the new mental health problem because mental health, if you all remember, never showed up in claims data in employers, but it was a hidden cost, and now very similar to mental health, headache and migraines need to be addressed. A few other statistics. Migraine is the second leading cause of disability worldwide, second leading, just to reiterate that. And it's the leading cause of disability for women under 50 years old. So if you are a company who have, of course, half of the employees are women, this is the number one disability for women under 50. And if you normally don't show up in your claims data, but if you really look at deeper, $6,000 to $12,000 in medication costs per employee, $35,000 in presentism costs per employee, $8 billion in ER visits across the United States, $8 billion. And it is the sixth leading reason for ER visits. It's higher than musculoskeletal and mental health. So that's how big migraine is. So what do we offer? So JOGO offers a digital health solution. So it's a combination of products that we offer. It's a comprehensive solution. We offer what is called an electromyography biofeedback solution. So just to give you an idea, just for headaches, American Migraine Foundation recommends this as the most innovative, most non-invasive treatment that you could provide. And it works better than medications in many ways. And it's been cleared by the FDA. And we provide also medication, diet management, and exercise management through our own digital MSK app as well. In addition to that, we give access to top migraine experts in the world. So a little bit of numbers, there are only 100 migraine specialists in this country for 40 million migraine sufferers. Can't imagine that because these migraine patients are just going to the primary care and getting the next medication that was just prescribed or detailed by a pharma rep. But that's what they're getting. They're not getting the best treatments for their migraines. So we provide a very comprehensive solution for migraines. A little bit on the electromyography biofeedback. So this is something many of them, many patients don't get exposed to unless they go to Mayo Clinic or Brigham and Women's Hospitals and large medical health, academic health systems. They have access to this. So EMG biofeedback basically helps migraine patients and many other patients bring muscle awareness. So basically what happens is a non-invasive solution in a migraine patient. You get these muscles in the forehead, that's frontalis muscles, they call it, temporalis muscles, just next to your ears and between eyes and ears, and upper traps, these muscles get tensed for migraine patients. And because of that, the body builds up anxiety and that builds up pain. That's the real impact of migraine, where people having migraine, that's the real pain that patients go through. By putting this on, and it's an 8-week treatment, patients use it once a week with the help of a therapist. They bring down the tension in these muscles, and by that, they're breaking the pain, anxiety, muscle tension cycle. And in clinical trials, this has shown to work better than medications and reduce significant ER visits due to pain. In a clinical trial conducted at Harvard Medical School, when we added JOGO to existing treatments, you see this quality of life in patients significantly improved, and they had lower migraine disability. These are very statistically high numbers. You could see that how well this works in a clinical study. JOGO also works for chronic lower back pain. These are patients who have gone through low back pain through the physical therapy program or a digital MSK program and still have pain. That's the chronic pain side of things. So when you have chronic pain in a clinical study, JOGO has shown to be superior to opioids in treating oxycodone and tapentadol. It's better than that. And you could see that how this is so impactful and effective. Our advisory board are mostly from Harvard Medical School, Yale School of Medicine, and of course, Mayo. Some of the best pain researchers and neuro researchers in the world are part of our company. Recently, JOGO received FDA's breakthrough device designation for showing that JOGO is superior to opioids in treating chronic lower back pain. And our pricing is very simple. We don't charge a per employee per month pricing. It's a very outcome-based pricing. So when the patient initiates treatment, you get charged $600. And when the patient completes the treatment, we charge another $600. Typically, it's a 10 sessions, 10-week treatment. And when the patient says, I'm feeling much better in a FICO scale of four above, we get paid a bonus or an outcome-based payment. And we have different pricing for different countries. You could see for Canada, UAE, and India, and including US. So JOGO is not just a migraine and chronic lower back pain solution. It's been approved to treat all these indications. So you're looking at a platform here, not a point solution. In urology, we are allowed to treat urinary incontinence, pelvic pain, and in men's health, premature ejaculation, erectile dysfunction. In neurology, stroke, Parkinson's, multiple sclerosis, and in pain, cancer pain, chronic lower back pain, musculoskeletal conditions, of course, and migraine, tension headache. And in gastro, chronic constipation, fecal incontinence, and dysphagia. You probably don't know, chronic constipation is one of the major causes of also depression in employees. Some folks ask us, how are you different from digital MSK solutions? We do have a digital MSK solution, and that's very comparable to many of these solutions that are out there. But we are beyond that. We have 21 indications under our belt. It's a platform, not a point solution. It's cleared by the FDA. It's prescribable by doctors. It's accessible at all major medical centers. It's not just simply a digital health solution that can be accessed only through telemedicine. So we have a lot more going on here, and it's a platform versus a point solution. Again, thank you so much for your time. We have shown that we have 4.5 ROI in members, and we are backed by some of the top institutes in the world. And hopefully your employees would have access to the JOGO solutions. Thank you so much.